Thank you, Chair, for your kind introduction. Actually, I've been invited by the scientist because I'm the scientist, but finally I realized I'm the chair of, as he introduced, of the CODEX Task Force for Antimicrobial Resistance. So I'll talk about the general scope of AMR and then talk about CODEX AMR. If you invite again next year, then I can talk about Korean experience. Otherwise, probably you should come to visit Korea. Then I can introduce the Korean veterinary and the Korean the food, the safety-related AMR and the hospital-related AMR surveillance and monitoring system. However, today I'll talk about the general scope of AMR and then more specifically introduce the CODEX AMR. So the epidemiology of antimicrobial resistance, you have learned a lot through this the conference symposium. However, I want to introduce one more thing in addition to the food animal, human hospital, aquaculture. Now we have to a little bit focus on companion animals because somebody asked this morning, some immunocompromised or that weak person can be infected easily through the acquisition of antimicrobial resistant microorganisms and resistant genes. This is the theme of One Health is one medicine through the health animal, safe and healthy food, and happy people will be guaranteed. OIE, World Organization for Animal Health, approach to One Health, protecting animals, preserving our future, because 60% of human pathogens generic, 80% of animal pathogens multi-host, and 75% emerging disease generic. So why it is an important global concern of antimicrobial resistance? Because there is a lack of coherent global approaches to prevention and containment. That's the reason we need to harmonize national antimicrobial resistance surveillance and the monitoring program and the implementation of international coordination program based on risk assessment. This is quite recent picture. CNN showed the superbug resistant to all antibiotics now in US. It's kind of the great issue, not only in US, but also all over the world. You may see this picture several times, so I'll skip this one. Unfortunately, that report released that China is the highest consumption, antibiotic consumption country for food-producing animal at the moment, and that they're going to be doubles in 2030, followed by other countries named Indonesia, Myanmar, Nigeria, Peru, and Philippines. It's a little bit about the Korean experience. We had host country. We did the host country of TFMR 10 years ago, and then now, again, we became a host country for TFMR of CODEX. 2005, we banned, prohibit, phase out the 28 AGPs, and then followed by 7 and 9. Now that all the AGP has been phased out in Korea, and then the veterinary prescription has been implemented in 2011. So it is quite significant the progress through the phase out of AGPs, except that the inopo 9 anticoccidiosis. As you know, that all the growth promotion, prophylactic, metaphylactic use is going to be a little bit concerned based on the precautionary principle. However, that the total contribution of animal products to human resistance less than 4% is reported by Bywater in 2004. There is also benefits of antimicrobial use in food animal production: higher survival, increased growth rate, decreased animal waste, and reduced foodborne pathogen, and animal welfare. You learned a lot about antimicrobial stewardship through infection control, education. I like that word engagement and capacity building. Professor Chen, my honorable respect to the scientists, mentioned about capacity building is most important for maintain antimicrobial stewardship. So how can we develop the strategies to control antimicrobial resistance in food chain? We need to harmonize and standardize to compare each situation at national level and international level. So we have to look at the critically important AMR factors should be developed, and then we also regulatory decision should be made based on risk assessment. So not an anecdotal evidence, but science-based and transparent decision making in public health is quite needed. Recommendation at this part, not only to food animal, but also the companion animal and science-based approaches is quite important in the future to accomplish One Health, One Medicine theme. So One Health, we should share the responsibility of all three health communities, including human health, animal health, environment health communities. This is some of the examples we published that companion animal can share the kind of antimicrobial resistance pattern and the genes in Korea. So we have published. The companion animal is quite a few. Not only in the companion animal like a dog and cat, but also the important, we found that antimicrobial resistant ESBL E. coli has been found in either in horses, environment, and human in contact. So probably in the future we have to look more closely to the companion animal rather than food-producing animals. The other way around, not only from the animal to human, but also human to animal can be transmitted through the antimicrobial resistant gene carriers. Okay, so international collaboration should needed, and then we have to develop as little as possible, as much as necessary. So we need to develop like an intergovernmental panel on antimicrobial resistance, like an intergovernmental panel on climate change. Now I want to introduce a little bit about CODEX antimicrobial resistance task force. 2016, 2 years ago, Korea has been elected as the task force for CODEX. And Korea has a responsibility, reduction and prevention of the use of antimicrobial resistant microorganisms in environment, farm, and fishery product and food from the animal sources. It's going to be 4 years, and we have to create the global guideline to monitor the use of antimicrobial resistant materials by 2020. This is the CODEX TFMR website, and then I was appointed 2 years ago. So I want to introduce the last 5 minutes recent discussion in CODEX on AMR. 2015, as I mentioned, that many people mentioned about FAO, WHO, drew the attention in the General CODEX meeting that the FAO, WHO, and AMR, including the global action plan of AMR and urgent action to mitigate risk of inappropriate antimicrobial use and resistance. So global action plan should be developed from the national action plan to regional action plan to finally to go to global action plan implementation. The CODEX members noted the many different factors reference, for example, reference to CIA critically important antimicrobial list, and how can we deal with growth promoters, and any alternatives, and the guidance for monitoring. And finally, we highlight One Health approaches. So that the establishment of TFAMR started 2017, and then review the two factors. First one is code of practice to minimize contact antimicrobial resistance. Second one, integrated surveillance of antimicrobial resistance. It's already, somebody mentioned the World Health Organization Advisory Group on AGISA, and relevant OI documents to support these kinds of TFAMR responsibilities. So next month, we'll have a second, actually sixth session of TFAMR will be held in Busan from December 10th through December 14th. The last year, fifth session was held in Jeju Island, November 12 through December 1, 2017. So first 10 years ago, first session through fourth session has been held in Korea, and then followed by 10 years later, we again to host it at the TFMR. So what we're going to do in sixth session next month, the issues expected by the delegates, the member countries, growth promotion, does feed contribute to AMR? So the feed, animal feed, will be a side event during the session, only side event. And alternatives, and more importantly, I do not want to spend a lot of time for the definition of terminology. However, the member countries still talking about crop health, agriculture, vegetables, and biocide, the environment as well. So approaches to AMU, monitoring and surveillance, should be stepwise or gradual or phased or needs-based. So we have to define the terminology at the sixth session. A couple of weeks ago, I've been invited to OI, second OI Global Conference in AMR in Marrakesh in Morocco. And the speakers, all different areas, OI, WHO, FAO, and OECD, and the Fleming Bank, and the World Bank, and the funding agency, agree that AMR tackling is one of the global key issues closely related UN's Sustaining Development Goal 1 and 2, which means no poverty, zero harm. That means we should share the responsibility. What international organization highlights during that OI Global Conference? International organization emphasize enhanced cooperation between OI, WHO, FAO, plus UNEP, plus industry, and so on. So it is not only three-party agreement can solve this problem. In addition to three international organizations and each countries, we should all together to develop that good strategies and based on One Health approaches. In economical perspective, the World Bank and the Fleming Fund emphasize the importance of investments in agriculture, infrastructure, public health, vaccine and hygiene, feed, and capacity building. International collaboration is important, as I mentioned. So finally, One Health approaches should be established through the human health, animal health, environment, all multi-sectors together to develop and engage and find that capacity building and the good stewardship. So that in Korea, I can introduce that the hospital surveillance and monitoring program, and then also veterinary programs, and then also food safety program together fight against antimicrobial resistance. If time is available, next time you invite. Thank you very much for your attention.